Prescription Drug Monitoring Program, or Pdmp for short, became operational in August 2016. It's a tool to help physicians keep their patients safe from misusing controlled substances. We've gotten quite a few questions from PAMED members about requirements when using the Pdmp, and we hope to answer a few questions here with Mike Siget, PAMED's Legislative and Regulatory Counsel. So Mike, back in November of 2016, when Act 124 was passed, new Pdmp querying requirements were set to go in place January of 2017. What are those requirements, and do they replace the original requirements?
Sure. One thing that I've told physicians that have called is to look at this in two avenues. There is a new requirement for benzodiazepines and opioids. So if a prescriber is going to prescribe a benzodiazepine or an opioid, they must query the system each time. So it doesn't matter if there's a refill, if they have to prescribe every 30 days, every 6 months, they're going to have to do a query each time they prescribe a benzo or an opioid. So that is one avenue. Then I've told physicians to look at it from the different way. If you're going to prescribe a non-opioid or a non-benzodiazepine, a different controlled substance, then the original two query requirements still apply. And that is that you have to query the first time you're going to prescribe that controlled substance for purposes of establishing a baseline and a thorough medical record, or if you suspect abuse or diversion of drugs. So if it's a benzo or an opioid, mandatory querying. If it's something other than a benzo or an opioid, then the original two querying requirements apply.
Okay. Are there any exceptions with the new law?
Yes, two exceptions took effect in January, and this affects inpatients and also affects patients going to an emergency department. First, for inpatients at a healthcare facility, or if they are in observation status in a hospital, the querying requirements do not apply after the first query. So if you have somebody that comes in as an inpatient to a hospital, let's say, a physician or other prescriber is still going to have to query the first time to establish that baseline and that thorough medical record. But as long as that patient remains an inpatient in that facility, querying further is not required. For emergency departments, if a person comes to an emergency department and is undergoing care in that emergency department, a physician or other prescriber does not have to query while that person is still undergoing care in an emergency department. Now, this is different if the person is discharged from the emergency department, and let's say the physician gives them a prescription to take home and fill at their local pharmacy, the querying requirement would apply then. So if they are still in the ED getting care, they do not have to query. But once that person is being discharged, and if they are given a prescription then, the querying requirements will apply.
Okay. We've also gotten a lot of questions from members relative to some new continuing medical education requirements that were part of Act 124.
Yes. Starting this licensure period for physicians, so the 2017-2018 licensure period, there are new requirements for CMEs. And there's a difference if you are a first-time applicant seeking your initial license versus a physician that's seeking your renewal. We'll start with the applicants first. For applicants, they are going to have a total of 4 CME hours. And I wrote this down so I don't mix it up. There is 2 hours in pain management or identification of addiction, and 2 hours in the practices of prescribing opioids. Now, the applicants have to have this done within the first 12 months of receiving their initial license, and they have to show proof to the board that they have completed that. Now, if you are a physician seeking a renewal license, then you only have to have 2 hours in any of those subjects. So it's 4 hours for applicants, 2 hours for renewals.
Now, has there been a determination made on what education will qualify and meet those requirements for CME?
At this time, no. We are in touch with the Department of Health and the Department of State, and once we have word on that, we will let our members know, but at this time we don't. And one thing to also let our members know is this is included in your 100 CME hours. So this is not an additional requirement. So if you're getting a renewal, you don't have to have 102 hours now. It's just part of your 100 hours.
Okay, and last question, Mike, is there a place where our members can go to find this information in case they may have further questions or there was something they didn't quite understand?
Absolutely. We have a lot of information on our website, pamedsoc.org. We have an opioid Pdmp section that has quick consults, fact pages. Also, our Knowledge Center can provide them with that information. And if they are looking something directly from the state, our fact page is also linked to the Department of Health's website that also has their own set of fact pages.
Okay, thank you very much, Mike.
You're welcome.